Welcome to Watch Your Mouth, the podcast by the Ministry of Health and Wellness Oral Health Unit. I'm your host, Dr. Chanel Dempster-Peart, and today we're diving into some of the real-life public health cases that are shaping the delivery of oral care in Jamaica. Joining me is Dr. Andrew Phillips, a seasoned public health dentist who's seen it all in our clinics, from common issues like gum disease and cavities to more complex cases that require urgent intervention. We'll be discussing the frequent scenarios faced in Jamaica's public health dental clinics, how dental caries and gum disease are treated, and most importantly, where you can access public health dental services. Now, if you've ever wondered what goes on behind the scenes in our public health clinics or how to take better care of your oral health, you're in the right place. Stay tuned for some insightful stories and expert advice. Today, you should hear some things that will make you go, Dr. Phillips, welcome and thank you for being with us today. You spent a lot of time in the public health dental clinics across the country. What are some of the most common things you've seen?
It's pain. I think I'd start with pain. Most persons who end up at the public health dental clinics are suffering from pain, and sometimes it's not for a short time. Oftentimes in Jamaica, persons are suffering for weeks, and sometimes months, trying various remedies, trying various things. And it's usually when it becomes absolutely unbearable that they turn up at our dental clinics, unfortunately. So I think that's what I would say is the most common.
Most common is pain. And what usually causes this pain in your experience?
Yeah, so we have maybe about three main things. The first one I start with is tooth pain because of dental decay. That can be as a result of dental caries. We also have persons with pain because of infections, swellings. That can be because of dental caries as well, or periodontal gum disease, gum issues. And then trauma. We do have a lot of cases that come in because of trauma. Children running around, falling, hitting the front teeth, people playing football, an elbow to the mouth, things like that. So I think those would be the three main sources, I'd say.
All right, you mentioned dental caries or decay. That's the same thing they call cavities, right? What causes that?
Yeah, so getting a cavity is a complex process. That is not something that's overnight. For the average person, to help them understand, there's bacteria in the mouth, and the bacteria in the mouth love sugar. And they break down the sugar, and as a part of that process, they produce an acid, and the acid weakens the tooth structure itself until it becomes almost soft and brittle, that it breaks, and it breaks in small areas, and then the cavitation starts. The small hole forms, and over time it becomes a bigger hole with more bacterial action, and also sometimes with what we eat and drink. Because while the bacteria are feeding on sugar, so if we're eating high sugar foods, they have the nutrients they need to produce the acid. We are also eating acidic foods, which are then making the teeth even softer and making one more prone to develop the cavities. So it's really, really about our diet and taking care of our teeth with proper brushing and such to help limit the possibility of us getting cavities.
Thanks for that, Dr. Phillips. But is there a reason why it's so common in the public health facilities?
Yeah, I think the main thing I'd say is diet. We, unfortunately in Jamaica, we have a dietary structure that is high in sugars. And I don't think we recognize just how much sugar is in all the foods that we eat and the various meals that we eat per day. Sometimes I see children at school or children at the clinic, and the children and the parent, they're sharing a drink or they each have one, and the drink has on it information about the amount of sugar in it, but usually the amount of sugar is labeled for one serving, but the bottle is actually 2 servings.
Wow.
And we're not really doing that math when we're buying the products. And it's 1 drink for breakfast, 1 drink for lunch, 1 drink in the evening. And so we are consuming a whole lot of sugar. and also things like sodas that are heavily acidic, the sweets that are high in sugar and offer no other nutritional value and are also sticky. So the sugary substance is now sticking onto the teeth and it's more difficult to clean off. It stays there for hours, maybe even days, dependent on, the brushing lifestyle of the patient.
Interesting. Gum disease is another one you mentioned, and it's another major issue we have. Have you been seeing that? And how are these treated in the public sector?
Yeah, so, the World Health Organization actually says in a report that in Jamaica, 2 in every 10 persons suffer from a gum disease. And periodontal disease, gum disease, it's very, very visible in our population. That tends to happen mainly when our brushing is not done well and we have an accumulation of bacteria around the teeth that causes inflammation, swelling of the gums, and then eventually destruction of the gum tissue as well as the bone around the teeth. And that can lead to your teeth eventually shaking. And for some persons, it's so bad that they can even take out the teeth themselves because
Wow.
the disease has extended so significantly. We also have a population that has a lot of diabetics, and our diabetics, because of poor wound healing, are more prone to periodontal disease if their diabetes is uncontrolled. So we have quite a lot of persons who will turn up to the clinics with periodontal disease, and sometimes they don't even know. Many don't know. In fact, we had post-COVID quite a few people who turned up for treatment, and their reason was that now that they had on the mask all day or during the mask for several hours, they started smelling their breath.
Wow,
And it was because of that they turned up and they're like, no, I need help. Something is wrong. And it's in that assessment that we're now saying to them, look, you have periodontal disease, you have a gum disease, and this is what is happening to you. This is where you are, and this is what we'll have to do about it. That being cleanings, sometimes you have to do periodontal scaling and root planing, which is a little more extensive than the regular cleaning. And sometimes we may even have to do minor surgical procedures to remove pieces of tissue or such to help clean up the environment and see if we can promote healing.
So, for persons who don't want to get to that extent, are there any early signs they could look out for?
Yeah, definitely, definitely. So periodontal disease is, you're diagnosed with that when you can no longer reverse the damage that has happened. But gingivitis, which I guess is more common to persons, is just when the gums are getting swollen, they're inflamed, they're tender. And oftentimes, persons might be brushing their teeth and they're getting bleeding from the gums. They might be trying to floss and they're getting bleeding from the gums. That's an early sign that you have a gum disease problem that one should be looking out for. Now, if gingivitis stays over a protracted period of time, the destruction increases, and then once you transition over to periodontal disease, where you're now actually losing bone structure around the teeth, that now is irreversible, and that now is when you're in greater problems. So definitely look out for the gums. The gums should look nice, soft, and pink. They should not look puffy and fiery red, and you definitely shouldn't have any bleeding from your gums if you're brushing or doing regular activities like that.
Okay, thanks so much for that. You have worked with different age groups, and some persons are of the perception that only children can access care in our public health
Yes,
facilities.
I've come across that.
Is that the case?
No, it's not. It's definitely not the case. The government dental clinics are open for everyone to seek treatment, and we advise this. Come in, see your dentist. We advise you to see your dentist at least twice for the year so that you can get an assessment, see where you are, and know what's happening. There are other groups that we may target, for example, our pregnant mothers, because, and I'll use your platform to share this, many persons have the mindset that because you are pregnant, don't go to a dentist. And that is wrong. It's absolutely wrong. Pregnant women should see their dentist as soon as you know you're pregnant, because of the changes that you go through. So the facilities are open and accessible, and we invite persons to come out and get your assessment, get your treatment done. It's not just for children.
And I take it's safe for those pregnant mothers to come and have this dental care.
Definitely, it's definitely safe. Because we spoke about gingivitis just now, for example. In pregnancy, a couple things happen. I'll give you just a few, just to tie them in together. During pregnancy, many women, their manner of eating changes. So they can't eat one big meal necessarily. They now frequently eat. So smaller portions more frequently. And during different stages of pregnancy, your fatigue level increases. So doing certain activities becomes more of a process or a burden. One such process is brushing your teeth. And so many women actually reduce the amount of brushing they do, but their eating frequency has increased. Apart from that, some women feel like they want to vomit if they introduce toothpaste into the mouth or even the toothbrush. And so now, rather than brush and go through this vomiting process, I'll just leave it alone. And so you can see this happening now over for hours, into days, into weeks, where this kind of thing happens. They're also more prone to gingivitis because their tissue is now more inflamed, more risk of bleeding. And if they actually are vomiting, the stomach acid weakens the teeth. So you put all of this together, it can be a real problem. So this is why we advise, come in, get seen, and let's see where you are, and we work with you going forward, the best way to keep you stable and to improve your oral health.
Interesting, Doc. Do you have a most interesting case, though, that you've ever encountered?
I do. I have quite a few, good and bad, I'd say. Maybe I can just give you good and bad. I'll start with the good. I had an interaction with a patient, a gentleman, who came in because he was having pain. He was having pain from a wisdom tooth that was broken down. Now, when he came into the chair and we assessed him, I could smell the scent of smoking on him. And so we had a smoking cessation discussion prior to his dental care.
Cessation?
Yes, to get him to seek to cut down and stop smoking for the betterment of his health. And we had a good talk, and we did the treatment, removed the wisdom tooth for him. In the talk, he told me how many children he had, and he's never taken the children to the dentist before. I was like, well, we're here, you know. But it was just part of the regular conversation. The next week, I came into clinic. When I came into clinic, he met me at my car, and I was like, Doc, I'm gonna bring the kids them. And he came there with 4 children. And I took him straight up with me, and I registered all 4, because that then I saw right then and there that he got information, and he was now actively using the information. And this is going to lead to the betterment of his children.
Yes.
And not only his children, but the change in the mindset will also extend to the generation after, because from that, his children's children might improve their oral health just because he decided to bring his children.
And his community, their community, they may share this experience at school that they now visited the dentist. All right, so that is definitely a positive experience. What about the most heartbreaking? Have you had any of those in the public sector?
This is where I saved the bad one for. And I think what affected me more significantly about this case is the fact that it happened to a child. So our children can't come on their own to seek dental treatment. They would need to get consent, and their parents would need to be there with them to provide consent for us to touch the children, for us to treat the children. And I had a 4 or 5-year-old boy who came into the clinic, and the chief complaint, again, the reason for the visit was pain. Mother stated that he was having pain, he's having pain for a couple of nights now, and she can't sleep. She can't sleep because he's having pain, so she can't sleep. So, all right, we went through the process and sat the child in the chair to take a look, and asked him to open his mouth. And when he opened his mouth and saw what was there, I could not believe it. I actually asked the mother's permission to take a picture because I wanted to use it for information purposes, and she accepted. That child at 4 had no serviceable teeth. A child at that age should have 20 teeth. No serviceable teeth. None of them could be restored.
Wow.
And this child was in pain from different areas. And for weeks, months, maybe even years.
I almost want to ask, where do you start in a case like that?
That was heartbreaking for me because it should never have gotten there. You know, if you notice while brushing the child's tooth or teeth that something looks discolored, check on it. Ask. Come and ask. Check what's wrong with this one. Why does it look like that? Don't wait for it to reach all 20. And so that was probably the most heartbreaking for me. And a close second would be another scenario like that, where a mother told me that she just thought that children had different color teeth. And so she thought it was normal.
And that's why this podcast, Watch Your Mouth, is so important, because we want the public to understand what normal is, what healthy is, and how they can access this oral health care with great dentists like you, Dr. Phillips. The elderly is another group that sometimes there are misconceptions about the importance of teeth.
Yes, definitely.
Any experience there you'd like to share?
Yeah, so it's interesting because for children, many parents believe that anything can happen to the baby teeth because the baby teeth will just grow out. They'll grow it out, so it's fine. If it mash up, it's fine. The elderly have a similar thought process where I am old, I should be losing my teeth. So because I am old and I should be losing my teeth, it's whatever. It's no problem. Yes, I should get this fixed. I don't want to fix it. Just take it out. I'll get a denture. And so that is one of the misconceptions that exists in that particular population. And it's very, very important for us in oral health and in oral health care to help our older patients understand your teeth are to stay with you for life, and they're very important for your function, for your speech, but also for your nourishment. And so without teeth, your diet will have to change. And for many persons at that age, they're having stomach issues. They can't eat properly. They're not able to nourish themselves properly because they have significant damage. And many of them are suffering from periodontal disease, shaking teeth. And many have, taken out the teeth on their own without seeking care. So we advise them, come, see us, let's see where you are, and let's know how best to work with you to get you back to a point of stability.
Okay. So it sounds like a lot of these issues are preventable. We don't
Definitely.
have to get there.
Definitely.
Are there any key steps you'd recommend to avoid gum disease or dental caries, especially for those who have access to the resources or can't come for regular treatment?
Yeah. So, the adage is there, prevention is better than cure. And dental treatment becomes more extensive and more costly the more that has to be done. So the best thing to do is to catch it or catch whatever problem or deal with whatever problem you have earlier. So the advice that I would give is to get your assessment. If you have never been to the dentist before, if you cannot remember the last time you've been to the dentist, don't wait until something goes wrong. Because if something goes wrong or you start to have pain, it means that it's really, really bad, And at that point, you're very limited in what can be done. So that's probably what I would say. Get your assessment, see where you are, and then once you are with a proper dental surgeon, when they assess you, see your state, they'll set up a treatment plan for you to know exactly what is best for you in your unique condition and to work their way forward with that.
Okay, I know that finding care, accessing care can sometimes be a challenge. How can someone find in Jamaica a public health dentist?
All right, so at many of our government clinics, there are dental sections, something that I am happy about. We do need more, and hopefully, the ministry will be pushing towards that direction as well as more staffing, more dentists, more dental assistants, more dental nurses, more dental hygienists. But all one would need to do, you can check the website of the Ministry of Health, and then that can take you to the local region where you are based. So for example, I am based in the Southeast Regional Health Authority. You can go through there and to get to KSA's website. And you
Kingston and
Kingston
St.
St. Angela Health Department, sorry, I used the abbreviation. And you can get to the website and you can get a list of health centers that are available, accessible. And then you can identify the one nearest to you.
Okay.
And once you identify the one nearest to you, you can call or you can visit to find out about the dental services that may be on offer at that local institution, and so that you can then get yourself into the system and become a registered patient within that health center.
Could you tell us a little bit about the services that are typically offered at the public health facilities?
Okay, so dependent on which government health center that you visit, the services may differ. That's mainly due to availability of resources, the location of the health center, the size of the health center. But in general, each health center that has a dental section can provide you with a comprehensive examination. We start there. Once a comprehensive examination is done and a treatment plan is determined for you based on your individual case, the clinician there can then most likely offer you cleaning, all right, cleaning services, as well as to offer you services with, our Second Chance Smiles program. You can go into dentures. Some other facilities will be able to offer you fillings as well as cleanings. Some may be able to offer you more complex services such as surgical extractions, but most can do examinations, cleaning, and extractions.
Okay, and then you said fillings at some as
Right.
well, because we
Many
want
too.
to save teeth.
Definitely.
Once we catch them early, we're
Definitely.
going to want to save teeth in the public facility. All right, Dr. Phillips, every guest on Watch Your Mouth, we ask for a word,
Mhm.
a parting word, like a last lick. What's yours?
I think mine would be lazy.
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 Let me hear.
And I want to add before it now, don't be lazy.
Mm,
Most of the dental diseases are preventable. Most don't need to be as extensive as they are.
mhm.
But we can be very lazy about how we look after ourselves and how we look after our care. And if we are lazy, we will have a cost to pay at some point later on with the damage that may be done. So don't be lazy with the brushing. If we are to brush for 2 minutes, brush for your 2 minutes. Don't be lazy with your visits and getting your children to go and visit the dentist, all right? Because their problem will become your problem as a parent, and that problem will stay with you for a while, depending on what goes wrong. So I think that's what my word would be.
Lazy, that's our last lick. All right, lazy. We won't be lazy with what we need to do at home, brushing, flossing, etc. A big thank you to you, Dr. Andrew Phillips, for sharing your wealth of experience and knowledge. It's clear that oral health is a key part of our overall well being. For those of you watching and listening, remember that prevention is always better than cure. Regular checkups, proper dental hygiene, and knowing where to access public health dental services can make all the difference. If you haven't seen your dentist in a while, now might be the time to prioritize your oral health. Thanks for joining us today. I'm Dr. Chanel Dempster-Peart, and this has been another episode in our oral health series. Stay tuned for more episodes, and until next time, keep smiling and taking care of your teeth. A happy mouth is a happy body.